indications for vacuum. Oh my God, I've done a lot of vacuum deliveries. Do I really have to do this? Oh,
well, you could study onc, but as you know, we get 30 weeks of onc. However,
I love
never.
onc.
I know.
What about those awards we're supposed to do?
Oh.
Wasn't that Ruth's job?
Yeah, but Ruth, per usual, is in labor, so we should just figure that out because graduation is coming up and we have to do the faculty, the community, and the new Purple Ribbon Award.
What's the purple ribbon?
Purple ribbon.
So it's like the physician who's done the most volunteerism and really has affected our residency with her or his volunteerism. So
Like community spirit.
yeah, community spirit.
You can put that back together?
Yes, of course I can.
I think we can. I
We can totally fix
think we
this.
bring some like duct tape. We'll get it fixed.
I think this is
So
perfect.
I nominate,
think?
I think Dr. Garrison, because she truly has been on that onc fellowship parade for at least since I've been here.
Yeah, but that's a secret fellowship. No one's supposed to know about it.
It's
we
not
have to-
that secret.
It's not that secret?
No.
See, I thought that she's gonna graduate and the graduation's gonna be announced, but the secret fellowship over the last 3 years.
Oh, is it like an unaccredited fellowship?
Yes, it's
Right.
an unaccredited onc fellowship,
Ah.
so it's supposed to be secret.
Is she finishing with us?
Yes.
Yeah.
Can I
So-
do that too? Secret fellowship?
The
You
train has
can.
left the dads.
And
But
it's not, I understand that it's very time intensive.
I can extend my residency.
Okay. They're very selective.
I think we
in
should
the
take.
volunteerism.
I think this is too much. We should just take a break and watch some TV.
Let's see what's on.
Tara, what are you reading?
Well, I'm supposed to be studying for boards, which is probably what I should be doing. But I found this book on all the second years, like all in their boxes, and I thought, I'm the chief, I should know what they're reading. It's called Their Curmudgeon's Guide to Getting Ahead. And I thought, I need to get ahead. So I'm looking through and it says, you should write down what you already know you want to say. So I thought to myself, I have this lady who really wants a hist. Her crit's like 48, so I can't get it approved, but I'm having a hard time telling her because she's like, take my uterus. So I wrote, you cannot get a hysterectomy. No puedes hacer un hysterectomy. You should try an IUD. It might help. But then I found this other section and it really confused me. So, you know how Dr. Flynn always says, call me Mike? I can never do that. It's like a respect thing, I guess. But anyway, it says, don't use first names with people considerably older than yourself until asked, and sometimes not even then. So I feel like with the considerably older, we really should question our use of calling Dr. Flynn Mike. What do you think? But, as such, maybe people our age we should call by their first name. So maybe we can try that and just see how it feels. It says the new generations are really starting to do this. It's undergone a cultural transformation. So let's try it.
Let's try it.
Okay. So how was your OR case?
Oh, you know, one of those days.
Yeah, so while you're gone, we got a consult.
Okay.
It was a Dr. Fisher patient. I called him up, 4:45. He sounded half asleep, which was not surprising. And he's like, Tara, just go do the consult, fast, fast, fast. So let's see who's in there now. They may have switched. And we're doing that new call the attending by their first name thing.
Oh, yeah.
Basically, it's supposed to be more professional. Dr. Flynn has started it.
But it depends
Yeah.
how old they are.
Exactly. If they're significantly older, you're not really supposed to do it. So if David Ow's in there, it's a no-go. So let's see. And I'm going to have Kim try to present. She needs to work on
Yeah.
the presentations. Knock, knock. Hey, we have a consult for you down in the ER.
Hey, Tiffany. So we have this 19-year-old G10.
Should we trial out that whole first name basis situation?
We definitely should.
Let's see who's in here. All right, let's see who's in here. Unless they're old. Hi, Franny.
What's up?
What have you done for this?
Hi.
Okay, Marina. Feed out your wheat. Oh God, Brie. Project Runway is on.
Oh, this is toast.
Like your favorites.
Welcome to UMass Memorial, Next Top Model, UMass Memorial Edition. We're down to our final 2 contestants. Our first contestant is our most fashionable resident here at UMass, Dr. Brianna Little. Come on down, Brianna. Woo-hoo! And now, straight from Brazil, you may know him as Marcelo of Labor and Delivery, but he is secretly a fierce fashion mogul. Come on down, Marcelo. Here he is. Look at that walk, that fierce walk. Woohoo! Look at that, ladies and gentlemen. Wait, what's that? There's one more? This just in, folks. There's one final contestant that we have for Project Labor and Delivery. Come on down. This just in, Dr. Aversa, contestant number 3 after a 30-pound weight loss. Woo! Look at that flex, folks. Who will be crowned the next top model of UMass Memorial Hospital? Now, the results are just in. And yes, it's Marcelo. Now, Marcelo, you are now queen of labor and delivery. On the news.
Oh yeah.
God, how many of these things do you have now?
Well, 2, 4, 8, 28, including the one still.
Wait, hold on.
I think 29. This will make 29 inside. I just had octuplets.
Oh my
So
God.
there's like, this is A baby, B baby, C baby, and we're calling him D.
Oh,
We haven't figured out his name yet.
where are the rest of them?
The rest are in the nursery. They have a rule here. I don't know. It's like still at UMass, but like there's a rule you can have 4 babies in the room at a time. So we kind of rotate in and out.
Wait, but how are you? How are you on the
I'm
monitor?
pregnant again.
What?
Apparently I'm really fertile. I don't know, but here we are. There's another one inside. It's really exciting.
Wow. Well,
So this will be the 29th. Because you have the name of my show, like Ruth plus 29.
are you still working?
No, of course. I stopped that a long time ago. That was exhausting. But so
Well-
now I'm just taking care of the kids. It's really exciting.
Congratulations.
Thanks. It was good to see you.
Good to see you.
Maybe you can take care of me in my next pregnancy.
Oh yeah.
It'll only be my like 27th C-section, so it shouldn't be that bad.
Yeah, see, has no problem.
Exactly. I'll call
Bye.
you then.
Yeah. All right. Well, good to
Thanks
see you.
for stopping
Bye.
by.
Bye, baby.
Come in. Hi.
Hi, Dr. Shoot.
Yeah. Hi. Are you Rob?
Hi, yes.
Nice to meet
Yeah, I'm
you.
your 3rd-year med student
Oh,
for today.
nice to meet you. Did you get my email? Because you look like you didn't get my email. We're gonna
Let
go to
me
the-
check for a
Yeah.
second.
Oh my god, I love this site, Etsy. I could shop on here all day. So I thought we could have our first teaching session at the beach, right? Like it totally makes sense.
Yeah, I mean,
So
I
maybe
see
we
it
could-
right outside your window.
Yeah,
so
exactly.
Convenient.
So why don't we, oh, 1 second. I'm just getting a message from one of my midwives. Hey, it's Dr. Shoot. Okay. Oh, I have a patient. 1 second. How many weeks is she? She's a primip, 36 weeks. And she came in with foot pain. And you checked her. Why'd you check her? All right. So she went from closed to dimple? Well, that's like fingertip. That's really concerning. All right, what's her group B strep? Well, it's negative, but it can be transient. Why don't you hit her with some penicillin and give her a shot of beta. There was this ALPS trial, and I think they included 36-weekers. I don't know if they saw a difference, but whatever. Just give her a shot of beta. And sprinkle some MAG at her. No one wants preeclampsia nor a CP baby. All right. What's her blood pressure? Oh, it's 90/50. We'll give her like a liter bolus, maybe 2 liter bolus, and then hit her with the MAG. Yeah. Yeah, and we'll get her to UMass. UMass can take care of this. We don't want a 36-weeker. almost fingertip. God, that could be 1 centimeter. That's too close to the edge for me. All right, sounds great. Take care. Bye. Oh my God, they keep me so busy here. It's unbelievable. So I was thinking we could go to the beach and talk about my favorite topic, the elective primary C-section. All right, let's go.
Good thing I brought sunscreen.
Yeah.
Excuse me.
Yes?
Hi, I'm an OB resident looking for a
What can I
plastics
do to help
consult.
you?
Didn't you deliver me?
Oh, I
Wait,
delivered a
wait.
lot of babies, so I don't remember.
Yeah, I think I remember.
Okay.
Weren't you a chief OB resident when I was a medical student?
Oh, what's your name?
My name is Jessica.
Jessica, yeah, I remember you. Oh my God. Are you a resident now?
I am an OB resident. I'm chief now.
You're a chief now.
Yeah, I'm looking for a consult,
I'm a
plastics
first year
consult.
resident now.
Oh my
no, no.
goodness.
Yeah, I'm doing plastic surgery.
You never stop.
Oh, I got bored delivering babies. You know, I don't want to deliver babies anymore. I wake up at night. I just want to make people beautiful, especially down there.
Yeah, well, that's what we need. We need a
Yeah.
plastic vaginal
Okay.
consult.
Okay.
Hey Liz, what's going on?
Not too much.
Starving. That yogurt is just not enough. I wonder what's going on here. Oh. You think that's all? Ooh. Not bad. Better get some snacks for later.
We're gonna leave some for the rest of us.
Just a little snack for the afternoon, you know. See you later. I'm starving. Woo! Pizza! Are you gonna eat that? I'm starving. What's this? I wonder if this is someone's. No. No. Not good. Maybe this is someone's yogurt. I'm gonna just have that. What's that over here? Pizza. Oh yeah. Coke. I need a Diet Coke. I'm gonna get fat from this. God damn it. Ugh. Where's my pizza? Oh.
Dr. Artinian, code white.
God damn it! Last piece of pizza. I'm coming! I'm coming!
Dr. Little, thank you so much for allowing us to interview you today.
No problem.
So we've heard that you've mastered impregnating the male species.
Well, yes, I've actually put many years of research into it, 10 to be exact. I decided that because men don't really offer much to the workforce anymore, that they must be useful for something. Therefore, I've decided that because the majority of them like to be stay-at-home dads, like, say, Dr. Choot's husband, for example, that why don't we just make them all stay-at-home dads? We don't really use them for anything else anyways.
And I've heard you have a patient here today that's willing to let us interview them.
Sure, let's go have a chat. We're gonna go see my patient now, room 494. Somebody I've worked with for a very long time, since my early residency days. Come on in. Stanley, how are you doing?
Oh, just great.
Great. I'm here with the CNN News. What they want to know is, one, how you're feeling.
Oh, I'm feeling great.
Too much, okay?
Looks like you're feeling great.
Yeah, it's starting to kick in.
So, truly though, why did you decide to be a gestational carrier?
Well, now that I'm approaching retirement, I thought I had to supplement my income, and it's working out pretty well.
Yeah?
Yeah.
So obstetrics just wasn't cutting it anymore?
You know, I'm gonna have to drop OB, but you know.
Well, you're sort of picking it up.
Yeah, I know, in a different way.
Yeah. Yeah. Well,
Yeah.
always got one hand in there.
Yeah, that's true. Well, I know what to expect.
Oh yeah, that is not looking good.
We need to call a code white.
All right, call code white.
Code white.
And code
Now?
brown.
This is Trish.
Yes, Stanley.
Move him. Turn him on.
Now.
Caitlin, it's time for a bedtime story. We gotta pick out one. How about this one, your favorite? The Mass in the Pelvis by Dr. Zweizig. Ready? The tummy felt so full, it was too full to play. So the poor little lassie sat in her house, all full and sad that day. Can you turn the page? She then went to the ER, where a CT was done. A mass in the pelvis, something can be done. That poor baby was scared going to the OR, but the magic hands of Zweizig were not very far. Can you turn the page? Not really. With a poof and a bang, the mass was gone. With a touch of chemo, the little lassie would live quite long. Don't you think? The end.
So, as an intern, I remember working with Dr. Green. Mostly, you learn from her on rounds, and you realize that when there's a big issue and someone doesn't know what to do, they always turn to Dr. Green. And then as a second year, you get the awesome experience of working with Dr. Green in clinic, and you see why everyone turns to her. She has this very reassuring demeanor with her patients, and she has this vast, one-of-a-kind knowledge base. We are definitely going to miss you very much, Dr. Green.
I wish I had a tenth of Karen Green's knowledge. She's an inspiration to all of us, not just because she's brilliant, but because she is compassionate and humble. And she is exactly who I would like to be. And we will miss her very, very, very much.
My anxiety level is like here right now, but when you go, it's gonna go here for a while. It'll come back down, but you're gonna be deeply missed.
And she has just such a calm elegance about her. That's something you really aspire to attain.
Some things that, you can only get from someone who's very experienced. She's an expert. I am so lucky that I have trained while she's here. Dr. Green, you are one of a kind.
Have a great time in retirement. We'll miss you.
I appreciated your guidance and the fabulous lunch at Nancy Chang's as well. So good luck in the future, and I wish you well, and I've learned so much from you. Thank you.
I want to let you know how much you're going to be missed by all of us here. For years, residents who have graduated and gone off to be in private practice or academic practice or whatever have called me up and said they've run into, disastrous situations, and at that moment, the thing that they always did was to channel Dr. Green. So your legacy is living on, and we are all going to miss you greatly.
Dr. Green, thanks for dropping so much knowledge on us. I'm going to miss you a lot and wish I had more time with you. But we're happy for you. Congratulations and have fun.
I really appreciated over the years your straightforward, no-nonsense approach to discussion of patient care, both in high-risk clinic as well as at the sign-out at the desk. I really learned a lot from your straightforward, no-nonsense, caring, yet to-the-point approach with patients in the high-risk clinic. I wish you the best of luck with the retirement.
Hi, Dr. Green. Thank you for everything that you have taught me about perinatology. You'll be dearly missed next year. Hope you have a wonderful retirement and lots of fun traveling. We'll miss you. Bye.
thank you, Karen, for everything you've taught me. I've had tremendous opportunities under you as a resident and as a fellow attending, and every time I hear, give me a break, I'll think of you.
So Karen, we're sitting in the GYN room, and this is where we used to do OB sign out. And I just wanted to thank you for scaring the pants off of me when I was a resident, because it made me read and it made me think I can be more prepared than I'd ever would have been otherwise. So Karen, thank you for all of that and everything you've given us.
Besides teaching me everything I know in OB/GYN, in OB, Karen taught me to see gray shades of gray, and not to take everything as black and white. And specifically, she taught me to be skeptical about cerclage.
I used to love OB rounds with Dr. Green at the A desk. I always knew when I showed up there with my long list of peri patients that it was going to be a very efficient, educational, and to the point, educationally speaking, sign out.
Good luck.
Good luck.